How much energy and hydration does your patient need to fuel their body? In this Med Mastery lesson, we'll learn how to estimate calorie and fluid needs. But before we dive in, let's learn why this matters. First off, when we talk about calories in everyday life, we are actually referring to kilocalories. 1 kilocalorie is the amount of energy needed to raise the temperature of 1 kilogram of water by 1 degree Celsius. As you can see, our bodies need a lot of energy to function like a well-oiled machine. Your body's baseline needs, or basal metabolic rate, refers to the energy needed to support all of your basic functions without additional expenditure. You can think of this as the energy needed to keep you alive if all you do is lay in bed all day and don't move. Any sort of activity, exercise, or illness will increase your needs beyond your basal metabolic rate. So even if our patients are lying in a hospital bed, their bodies can be burning thousands of calories trying to heal and get over their illness. You could think of it as their body is running a marathon while they're in the hospital. Even though they aren't completing their daily activities or exercising, their body is expending lots of energy. Remember, malnutrition negatively affects your patient's ability to heal and quality of life. So making sure we're getting them the calories or energy they need is of the utmost importance. While underfeeding is detrimental, overfeeding can actually be just as harmful. Overfeeding has been associated with many complications, including increased rate of infections, liver problems, hyperthermia, hyperglycemia, hypertriglyceridemia, and fluid overload. In ventilated patients, it is also associated with difficulty weaning from the ventilator. This is why we do our best to estimate our patients' needs correctly. The gold standard for estimating energy needs in ventilated patients is indirect calorimetry. This method measures oxygen utilization, carbon dioxide production, and minute ventilation to estimate a patient's energy needs. However, this method is often not available, so predictive equations are what dietitians use most frequently to calculate energy needs. There are so many things that go into estimating a patient's energy needs: disease states, BMI, whether or not they have malnutrition, whether or not they're ventilated, what sort of therapies they're on, and the list goes on. For the purposes of this lesson, I'm not going to go into detail on predictive equations, because my goal for this course is to teach you to come up with basic energy needs without needing a bunch of math or a dietitian qualification. The easiest but perhaps least accurate way to estimate calorie needs is by using kilocalories per kilogram. This is the method I want to teach you as part of this course on clinical nutrition. Let's stratify patients in terms of BMI and calculate their needs from there. First, we'll look at patients in the non-obese weight class, so with a BMI of less than 30. For patients in this weight class who have mild to moderate illness or injury, the requirement is 20 to 30 kcals per kilogram. Generally, this applies when one area or organ system is affected. For example, a non-hemorrhagic stroke, pneumonia, or kidney disease on dialysis. For patients with a BMI under 30 who have severe illness or injury, the requirement is 25 to 35 kcals per kilogram. Generally, this applies when 2 or more areas or organ systems are affected. For example, an aggressive cancer causing malnutrition, a vehicular crash victim, decompensated liver disease, or a patient with an open abdomen after a complex GI surgery. Next, we'll look at patients with class 1 to 2 obesity, so who have a BMI of 30 to 39. The requirements for patients in this group depend on whether they're ventilated. If they're on mechanical ventilation, the requirement is 14 to 17 kcals per kilogram. If they're not ventilated, then the requirement is 15 to 20 kcals per kilogram. Finally, we'll look at patients with class 3 obesity, so a BMI of 40 or more. The requirement for all patients in this weight class is 20 to 25 kcals per kilogram, but using ideal body weight, or IBW, instead of actual body weight. I use the Hamway method to calculate ideal body weight. You'll need to know the patient's height. For a male patient, ideal body weight equals 106 pounds for the first 5 feet, plus 6 pounds for each additional inch. For a female patient, ideal body weight equals 100 pounds for the first 5 feet, plus 5 pounds for each additional inch. You can then convert the weight from pounds to kilograms. Now that we've been through the calorie requirements for each BMI category, let's put them all together. This table will be a helpful overview that we'll come back to later in the case studies. So for a patient with a BMI under 30, if they have mild to moderate illness, they need 20 to 30 kcals per kilogram. If they have severe illness, then they need 25 to 35 kcals per kilogram. For a patient with a BMI of 30 to 39, if they're ventilated, they need 14 to 17 kcals per kilogram. Whereas if they're not ventilated, they need 15 to 20 kcals per kilogram. And finally, for patients with a BMI of 40 or more, there's just one category, with a range of 20 to 25 kcals per kilogram. But remember, for this BMI group, we use ideal body weight. It's also important to remember that malnutrition puts stress on the body and increases patients' calorie and protein needs. So if you suspect that your patient is malnourished, you should increase their calorie needs range by 5 kcals per kilogram. Finally, let's cover fluid needs. To calculate fluid needs for adults, you'll use 30 to 35 mLs per kilogram of body weight, regardless of BMI. So now you're able to roughly estimate a patient's calorie and fluid needs, which will be necessary to get them started on a nutrition regimen, whether that be food, tube feeds, or IV nutrition.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how MedMastery can help you become a great clinician, make sure to watch the About MedMastery video. So thanks for watching, and I hope to see you again soon.